So good afternoon. My name is Marjorie Dixon, or Dr. Dixon. I am the CEO and Medical Director of Anova Fertility and Reproductive Health, which is a fertility center in Toronto. So I know that I'm on a clock, and I'm going to just be talking a little bit about the services and what we provide. But first, to begin with our mission and vision. I grew up in Montreal and moved to Toronto to do my residency. Came to the States to do my fellowship. I did it in Vermont in reproductive endocrinology and fertility. Went back to Toronto and started working at the University of Toronto in another clinic. And I wanted to do a lot of third party because I trained to do it in Vermont, but unfortunately when I came back to Canada, it was like stepping back in time. People were not very open to what I wanted to do. I had patients, gay men that I wanted to put through, and I was told that it was illegal and it's impossible and it can't be done. Fast forward to the year 2016 when I opened my own IVF center. The environment and the climate was very much different. People were lobbying the ministry to make new laws to make the creation of babies through assisted reproduction easier for families, and now we're in the year 2018 where both men's names can be included on a birth certificate right off the bat as the intended parents. So we've come a long way, okay? But this is the first next generation IVF center in Canada. We, in our mission statement, pride ourselves on being leaders in innovation, education, and communication, and transparency for our patients. We're committed to making the right to family accessible to everyone. That's a big one. That's always been part of our mission. And we do have a culture of support with effective process and a holistic approach. So I know that when you come into this forum, you are thinking about growing your families. You are also thinking about the women who are going to be participating in the growth of your family. And it's important to us to be able to be caregivers for both, well, for all the people who are involved in collaborative family planning or third family planning. And we talk about that means the egg donor, that means your gestational surrogate, and that means you as intended parents. And we're role models for our community. So surrogacy in Canada, of course, I'm a professional shopper. We're always on sale to Americans because of the exchange rate. That's just a fact until maybe something changes in the economy. But the way that things work for gestational surrogacy in Canada, there is something called the Assisted Human Reproduction Act, which stipulates that there has to be reimbursement and not compensation for gestational surrogates, which is very important for you to know. But we work with agencies that also take care of managing, putting you in touch with legal representatives or lawyers that will be able to take care of all of that in your contracts. In Ontario, there's also provincial funding for fertility care. So if you are working with a gestational surrogate that's an Ontario resident, if she has not been a gestational surrogate before, she can be included in that. But in the initial testing portion, so blood testing, if we're doing an assessment of the uterus, if we're doing an ovarian reserve assessment, all those things can be covered by the ministry program if she's an Ontario resident. The parents' names are on the birth certificate. That was one that I mentioned. So there's something called Cy and Ruby's Law that came into effect in January of 2017, which is such that the intended parents at the beginning of the surrogacy journey are the parents that are included on the birth certificate. So at the time of birth, it used to be that there had to be a second parent adoption, and the name then had to be taken off the birth certificate, then the intended parents' names were then inserted onto the birth certificate. That has changed. And there was some question I heard earlier, one of the lawyers was mentioning to me that there was a query or a thought that it is difficult to bring your children back to the US depending on the state. That is not true, so I want to kill that myth. There are different rules about different jurisdictions, but gentlemen always are able to bring their children back into the US without issue. And we're LGBTQ friendly. Notice the flag. Also Canada versus the US, I mentioned reimbursement and compensation is the difference. The provincial healthcare versus health insurance, but all of the same components exist. The last bit, no discrimination, in a utopic word, that's great. There's much less discrimination. In fact, Canada is a very, when you think about left wing, right wing, it's a very liberal place. But we have also now followed in a jurisdictional way. So the laws are actually following our politics, which is very good for LGBTQ family planning. So a patient story. So this is Joey and Corey. They're actually patients of Anova, and they just recently had a little baby girl. They're from Saskatchewan, so they were living in Regina. They actually came to Anova in Toronto for their journey, and they wrote a piece about it in cbc.ca. And one of the things that they mentioned was that parents have a much better and easier access and accurate and appropriate parental recognition with fewer barriers now. And he's a writer, so that's why it's said so eloquently. But they gushed about how they felt so welcome from start to finish by everybody in the clinic, and that they felt supported by their agency, their gestational surrogate, their egg donors. They really were thinking before they entered into the agreement or the plan to have children that they were going to encounter many more barriers. So it's nice to know that in 2018 there are so many systems in place to assist you with growing your families. So our commitment to you with third-party services, our goal is to have your baby in your hands between 12 to 16 months. It's a process. So 12 to 16 months sounds like a long time, but by the time we assess the egg donor, we assess the gestational surrogate, we have to do the infectious screens. There's a semen analysis for both partners or a single individual if there's a single dad planning a baby. We are competitive with other places. We actively manage the care, which means that we have dedicated team. When we were started, we didn't recognize how quickly we would grow in this program, so we started off with a smaller team. Now we have a dedicated team of people who are just for our third-party collaborative family planning dedicated at Anova. And they are, what I do know about my staff, and it's included in our mission statement, we strive to be the best. We don't necessarily want to be the biggest. We just want to be the best and represent for our patients a compassionate and welcoming environment while being scientifically sound. Okay, so what to expect when you arrive at a fertility clinic? Well, first, you might not arrive at the fertility clinic. It might be a Skype consultation. So that might be because of geography that we would have a first consultation where your medical history is taken. You're given some information about the program, the variety of packages that exist. And then in as much as the medical history, your reproductive history, if you've ever had any sperm testing or ever endeavored upon the route to grow your family, if you've ever had current blood work for infectious diseases, things that might need to be updated. And then what we offer on site. So we're a full service clinic. We would be able to monitor the egg donor at the clinic. So she would come in for blood and ultrasound. Initially, she comes in for a test of ovarian reserve, and ovarian reserve testing is just to see how good the eggs and the ovaries are at making babies, because it's one thing to select someone and to connect and decide this person's going to be your egg donor, but it's also very important for the healthcare provider to make sure that this is a good person to be choosing for this, because there is a variety of things that can happen to a woman's reproductive ability throughout her reproductive lifespan, so she needs to be assessed on a case-by-case basis. And then we also provide the services of doing the semen analysis and semen DNA fragmentation testing as well. We can do cycle monitoring, we can do inseminations, we can do IVF on site. So with our next generation Ivf Lab, we have all of the ability in our lab to do even things for severe male factor infertility. So we have microfluidic bead assays that we can do, something called PIXI as well as ICSI. We're looking at actually doing DNA methylation testing on sperm, constantly pushing our envelope of innovation. And then also we can freeze, crop preserve, and then do pre-implantation genetic testing for aneuploidy. Financial options, this is the part that I don't know too much about. That's why my team is here and they have a booth upstairs if you have further questions about that. But really accessibility was a big one for me. So we make sure that not only do we have a variety of packages that are available, but we also have a financing option on site. It's a third party that we work with because so many of our patients come from different socioeconomic places. So those that need to have recourse to additional funds, they can do it through a financing program as well. And apparently it's available for up to 60 months. That part I didn't know. Thank you for putting it on the slide. And we also have an integrative health component at Anova. So we've just developed the 15th floor. Anova, the embryology portion and the cycle monitoring portion is all on one floor. But we have a separate, kind of like a spa, an integrative health spa that we have. We work with naturopaths, acupuncturists, chiropractic, massage therapists. Am I missing somebody? Counseling. So it's all offered on site. And so if the gestational surrogates are coming for their transfer, they can actually have acupuncture, an acupuncture package leading up to it. And then the acupuncturist will come down to the IVF suite and provide acupuncture on the day of the transfer. And also, if there are egg donors involved for pain management, we also can offer acupuncture as a package leading up to the egg retrieval process as well. So as you care for the person who's helping you to grow your family, we will assist with making it convenient for you and also making it calm for her, because the environment, it's on the 15th floor and it's like you see the city of Toronto across the DVP. It's really calm and zen. As you drop your blood pressure, you get on that floor. It's easy. We also offer patient support groups as well on site. Those are also no charge for those. We just really want to, in French we say encadrer, which means surround, to surround the patients that are involved in the care in our center. Okay, I mentioned PGTA, pre-implantation genetic testing for aneuploidy. That's one way that it's kind of PGS 2.0. So we use something called next generation sequencing. And essentially, once you've created the blastocyst, there's 5 days of development for an embryo. There's the fertilization day, then you get a call about your fertilization, then it goes to day 5 where they're blastocysts. At the blastocyst stage, we can take a biopsy of the trophectoderm, which is the outer part of the embryo, which becomes the placenta and membranes. And we amplify the DNA message, so we make the genetic message that we take about 4 to 11 cells. I don't, the embryologists do. And they amplify the DNA message, and then they chop it up and run it on a sequencer. And then you can find out all of the 22 pairs of autosomal chromosomes. The 2 sex chromosomes in Canada we're not allowed to disclose. So that's one thing. Sex selection is not an option for you in Canada. That's the part that's illegal, so we can't. Any physician that assists you with sex selection in Canada is at the risk of 10 years in prison or $500,000 of a fine. So this physician won't be helping. But we can do the pre-implantation genetic testing. So we can find out the common ones, trisomy 21, 18, 13. Those are the things that we can allow you to know. And then we also provide genetics counseling, which is included in the PGTA testing. And then why are labs and embryologists? I talk about next generation Ivf Lab. We know what that means. It's because of the way that it was constructed, the HVAC system, clean room creation, engineering, commissioning of the engineering. It's a fancy next generation lab. The old labs were not done this way, but we didn't have the information about volatile oxygen compounds, which is what is problematic for embryos when you're growing embryos. Why is it important for you to know the difference? Because not every single clinic will have a similar rate of success. And we want to get you success, Tinkerbell. We want to get you success in the shortest amount of time with the least amount of transfers, and we endeavor to do that with a single embryo transfer at a time. I say that because that's safest for your gestational surrogate. It's the safest way to have a healthy baby to term and the least amount of complications. Okay. All right. I'm almost there. Guided tuning fertility specialist. We, again, 5? That's 5. Okay, got 5. I'm good. We believe that the LGBTQ community has a right to have a family like everyone else. We believe that you should have a choice in your fertility specialist. You should also know if with the center that you go to, are your fertility specialists used to doing this, or are they going to dabble or just start to learn to do this? We do this lots. Check out their credentials. Go wherever you're thinking of going, regardless if it's to us. Go online, look at credentials, look at what your physician has done. What kind of things do they publish? What are they involved in? Do your homework, because not everything is created equal, and you need to do your due diligence as you enter into this. And you need to feel comfortable and safe. And I can say that because I have children through IVF, and I married a woman 20 years ago, and we now have 3 grown-up children that make us crazy like everybody else's children, so we want to share with everybody else. And yeah, this is just some of our success stories. Some of our dads who've had babies, those kids, this baby is now 8. Hard to believe, time flies. And then I just wanted to show you some pictures because as I try to communicate how pretty and warm and inviting it is, I'm a little OCD, so when we were designing it, it's blue and white to be like sea and sand, just saying. And it really, you get a zen feeling when you do come in. We have spa music playing. As I said, your blood pressure drops. So that's the weight room on the clinic side, so that's where monitoring happens. This is the weight room on the IVF side. Someone gave me something about shoes. There's a Louboutin book right there, and the Chanel book there. We're gonna put Michelle Obama's new book there too. These are the pre and post areas. Notice that they're big, and we did that on purpose because families come in all shapes and sizes. So if we need to add chairs or additional people in there, we can totally accommodate, and the same thing for our ORs. So we often have both dads, the gestational surrogate, sometimes her partner in the room. It's a giant party. It's not a party, but there are a lot of people in, and we can accommodate that. And this is just showing you, we actually have a camera that leads to the microscope, so you can actually see what happens to your embryos as they're coming. And then the other one shows, this other TV doesn't say Anova, it actually shows you the ultrasound, so you can actually watch your transfer in the room. And that's it. And I came in time, right? Good stuff. Questions? Self-explanatory? Yes?
Once the surrogate has graduated from your fertility clinic, do they go to monitor by their local OB-GYN?
It depends. So sometimes they do monitor with us. Most of my patients, we monitor through the first trimester. And so that means that they get to the place where we actually do NIPT screening, which is the non-invasive prenatal testing. That's cell-free DNA in the first trimester, so you get also to know, to corroborate with your PGTA. And then we do the final nuchal translucency screen and send them on their way. So we also do the ultrasound scanning before they graduate. I feel responsible, but sometimes intended parents prefer for them to go back to whatever jurisdiction they came from, and then we will satellite monitor with them.
So you assist also with all the legal work?
So I don't assist with the legal work, yes, but yeah, we work in concert with lawyers that are specifically dedicated to this assisted reproductive technologies with third-party collaboration. So yes, we do. So we kind of have a group of people that we work with. Like we work with egg helpers, and we also actually lobbied our minister. We went to Ottawa together to make noise about how we needed to change laws. Like we are really working hard to change the environment, which is coming to pass. I'm also working in the US. I do a lot of work with the assisted ASRM, the American Society for Reproductive Medicine, and I just gave a talk about transgender medicine, the delivery of care to trans men. So all of these things, we're making little headway, so that in the next 10 years, this will just be like, everybody does it, it's cool.
What's the overall cost of the process?
So it depends. Those are the different packages that we have. It can start at 20. It can go as high as 40.
35 American.
Oh, okay. So right, American, see on sale. I forgot that.
Do you do surrogate matching?
So we work with surrogacy agencies in Canada. So they will match you, and then once you have a match through them, we get the profile, and then we start the assessment. So we work together.
So when somebody goes to you, you guys recommend the agency, or how does it?
Yes, so we have a group of agencies that we work with, and then we recommend the ones that we have vetted and we know that are reliable and responsible to do this well. And then you pick. They match you up with a gestational surrogate, and then we do the assessing. Once she's gotten the medical clear, done. Once she's gotten the medical clear, then we sign her off and we start the process.
So do you know the cost of the whole thing?
No.
Do you work with surrogacy agencies in the U.S.?
Yes. We have, yes.
So if you want to, they're probably doing individual consultations, right?
Yes, we're doing individual
So
consultations.
if you want to schedule an individual consultation, make sure and get with them to schedule one of those.
Yes, and you can look at Petra over there. I can talk, but she knows how to organize me in Corrali. So please talk to Petra, okay? Thank you for coming.